So Iain Duncan Smith, as promised, joins me on the line now, former Conservative Party leader, of course, and Member of Parliament for Chingford and Woodford Green. So Iain, do you believe that it's really all about just £5 million?
Good morning.
Good morning, sir.
Right. Well, I think it's these things are always a problem negotiation. I think the problem for the government at the moment is that what Andy Burnham is asking for is proportionately, as I understand it, more than was given to the Merseyside city region. The concern the government's got is they've agreed with a number of councils a formula. They've increased that formula for Manchester on the basis that there's a wider and greater population. But I think there was a discussion, as I understand it, finally between the Prime Minister and Andy Burnham yesterday. And the Prime Minister said, well, look, 55 million is what we think is right. You're asking for 65. The answer is, why don't we just compromise at 60? I'm prepared to go up a bit because, I recognize that, you may have some particular problems, but let's compromise at that. And what I understand is that that was rejected on the basis that he said he wanted the whole 65. So I don't know, though I wasn't privy to discussions, but that's what I understand from listening to the radio this morning. So
heck of a price to pay to have chaos and fury as Johnson forces curbs in Manchester, PM facing the wrath of Manchester, PM playing poker with the pandemic, and even the Times, Manchester forced into the house. For the sake of a few million quid, buy some peace, Iain.
Well, maybe, but then again, The other thing that's out today is the borrowing figures. I mean, they are the third worst since records began. We are spiraling into a debt problem, and the government does, at the end of the day, recognise that it's going to have to pay other money to other areas that may have to go in. You hear about South Yorkshire today.
Sure. Sheffield just confirmed.
Yeah, I mean, they had as far as I understand it, the government had very good discussions with the Merseyside City region. They agreed a figure with them. That was done. The South Yorkshire, that's been done, I gather, going very well. Straightforward discussions. In other areas, it's gone well. Everyone's stepped up, compromised, balanced their asks versus the money given. It's in the Manchester City region. And I also understand quite a lot of the mayors in the area, or not the mayors, quite a lot of the chief execs in the Manchester City region are very keen to get something sorted pretty quickly. So all I would say is, look, I'm not going to try and point the finger at anybody. We need to get this balance. We've got a problem on our hands, which we all have to sort of bend to and accept that there are compromises in these things. And I think we need to accept that, really.
Okay. What about your own rebels? I mentioned in my introduction to you, although you've served in government in high office, you were also a former party leader, which is important in this context. When you've got Sir Graham Brady, the chair of your backbenchers committee, and you've got a range of Tory MPs in the Greater Manchester area, and now a smattering of what you guys call the Red Wall Tory MPs, new intake people, rocking the boat. That is quite worrying in terms of party management, isn't it, Sir Iain?
Yes, I think actually I'd look at it from the other perspective. What MPs are doing is trying to reflect what their own constituents are saying to them and are concerned about. And I think there is a concern in places like Manchester, to be fair, that any direct sort of stage 3 or tier 3 lockdown, as it were, is going to massively damage economic activity. And we've already been through one terrible lockdown where we were told, it'll last 3 weeks, and it ended up lasting over 3 months. And we were beginning to come out of that, and we go back into this again. This is going to be even more damaging. I think businesses won't survive a second time round. So I'm sympathetic to those, because I do feel that what's happened is the scientists themselves in SAGE, and I wrote about this the other day, I think are in a kind of groupthink at the moment, and they're not in the slightest bit influenced by what's happening within the greater economy, which is a really important feature. We need to balance that. So trying to get this under control at the same time as recognizing, if we shut down the economy completely, then all the other things go wrong. People are dying because they can't get cancer treatment, heart disease, dialysis, because hospitals aren't able to take them because they've cleared the decks for coronavirus. We've become very kind of what I call the one club process, a one club golfer, and with only one target. And government and country isn't like that. I have a concern that in our absolute pursuit of the one area which is infection, we are simply going to suppress, reopen, suppress, reopen, suppress. And that means every time businesses will open, shut, jobs will be lost and not be brought back. So there's a wider canvas. And my view about this is that we absolutely know from the figures who this disease attacks. It attacks people with comorbidities, particularly. The number of people that have died globally who have not got known comorbidities is well under 4%. So that means we know the at-risk group. We now know something which is not being talked about. You've got a scientist on later on, I gather. We all talk about the possibility of a vaccine, and everyone's hoping. But, vaccines, there are not that many of them that have ever worked. So let's hope, fingers crossed. But in the meantime, there's something that nobody talks about, which is the arrival of the antivirals. The death rate for those who are infected has fallen from 3% now to 0.6%. Massively, that's improved treatment, but also massively because people are getting antivirals to suppress the symptoms. So I'm asking why we aren't getting ready to move those antivirals out to the GPs to give to those at-risk groups as soon as they know that they are infected, to try and suppress that process, which we did in 2012 with flu. So, yes, the vaccine, but let's get real. We're going to have to learn to live with this. And learning to live with this is finding ways to stop people getting into hospital, which is the key target, more than the infection rate. If you're able to get to those at-risk people who go to hospital, then into the ICU, suppress their activities, their infection, then you stand a greater chance of bringing this under control in the longer term.
Putting it absolutely bluntly, and I think I can risk doing that, it was said by two scientist guests earlier on the programme that we've got better at testing, although it's not yet universal. Therefore, the increase in the instances of test positive stroke cases is big, but it's not necessarily leading directly to people becoming ill. Secondly, those that do become ill, we are much better at treating them, and you've given yet another example of that in the hospital. And thirdly, here's the blunt, unsubtle bit. The majority of those that were going to die from this ghastly disease probably have now passed away. It's time to pause and move on.
Well, I can't comment about the latter one because, I say that's a figure that I haven't seen. What I do know categorically, and is very clear here in the UK and elsewhere, that the average age of death is 82 years old at the moment. You can say it's between 80 and 82. So it's in the life expectancy zone. And I know that there are other complications, and nobody by any means is trying to downplay these. Absolutely not. But we've got to balance that against the problems we've got with other people with other diseases, with these comorbidities, not being able to get treatment for those comorbidities. And that's what concerns me, trying to get balance. I don't profess to be the absolute expert on this, but it does seem to me that this whole area of understanding how we work to suppress this disease before people get into the community, not just chasing the infection rate. Yes, trying to suppress the infection rate is an important thing, but if it's done at the cost of everything else, then what we do is we shift the balance of problems elsewhere. And that means sometimes people who are younger, in their younger age groups, then get affected adversely. I'll give you an example of this. Schools really need a much clearer level of advice. We've got year groups going home because one person has tested positive. What do we know about people certainly under 10? Is that they're not really vectors for this. It's that they get infected by adults, but they're not really critical in passing to adults. So we need to have a better way, because at the moment, children's education is being ripped apart. And this in itself has consequences for us in the next few years, because they won't get the sort of education that they need, which allows them to get on and do well later on in life. These are all important factors.
I totally agree. And final quick question to you then, because it kind of sums it all up. For whom is that a decision, Iain? Is it Matt Hancock as Health Secretary? Is it Simon Stevens as the boss of the NHS? Or is it Boris Johnson as the Prime Minister? Who says, look, if a kid of 10's got it in school, don't worry, it's not a problem? Or who says to the GPs, do send out and prescribe antivirals? Who's in charge, Iain?
Well, this obviously comes down to the government. Government ministers decide. The old rule of advisors advise and ministers decide is critical. That hasn't changed. I worry, though, genuinely, that the balance of advice across the piece of areas that will be affected needs to be much clearer. I think it's fine for a group called Sage to come out and make absolutes about you must lock down for 2 weeks as a circuit breaker. These are euphemisms which I hate. The circuit breakers are business breakers, and at the end of the day, that's lives, livelihoods, and quality of life. And so, just to glibly say this is a circuit breaker, I think is wrong. Be honest what you're saying to people, which is you're going to shut the economy down. And that may not open again in 2 weeks' time. Unlikely to, frankly. It didn't last time. So my question really is we've got to get the balance. Governments have to decide these things. But I think the real issue here is, there's dispute amongst scientists about this. So let's get that clear, that there is no absolute. But I do wish for balance and good advice. And the advice, genuinely, I think all the medical stuff shows this, that we can be more flexible amongst primary schools, and that the education of children, needs to be very carefully nurtured. Otherwise, if we just keep sending whole year groups home the whole time, then all that's going to happen is these kids are going to be a problem. And by the way, parents who have to work then have to give up their work to come back, and that causes chaos for them as well at the same time, creating real financial problems for them. So the balance of this is really where I want us to be. In the advisors, as much as the government, everyone blames the government. Of course they do. But if you look around Europe, every government's facing the same problems. But at the same time, advisors need to also take on the mantle of trying to get the balance right, rather than just saying, yes, this is the science, this is medical, this is what we do, absolutely, but not getting the balance of what happens as a consequence.
Iain Duncan Smith, thank you very much indeed.